I am so glad that we're talking to Jonathan Javitt. Jonathan Javitt is the founder, director, and chief scientific officer of NRx Pharmaceuticals. They are publicly traded under the stock symbol NRXP, and there's so much news going on with this company. And we've had the pleasure of having Jonathan in studio a number of times, and we're going to have him in studio again, I believe, next week if I can talk him into it. But I wanted us to take the time today and let Jonathan kind of go through all of the recent news that's going on. Keeping in mind, Jonathan, that not only are we in 125 million TV homes on American Life Network and Biz TV, we also picked up Bloomberg Financiero in Mexico with another 15 million homes, and now we're running a pilot series for Bloomberg EU, which puts you in another 25 million homes. So you're going to have a kind of a big platform here, but I want you just to bring forward to us all the latest news and maybe give us a real top-down story so the folks that haven't heard you before can kind of hear what the story's about. Great to have you along, Dr. Jonathan Javitt. Good to see you.
Well, thank you, Sully. And by the way, you forgot to tell me about being in all the ships at sea.
Oh, 175 countries? That's right.
Yeah.
He knows the script.
I just want you to know you got a big platform here, so you take advantage of it.
No
pal.
pressure.
You go.
So it's really been an extraordinary week. You know, in 1987, my younger, smarter, better-looking brother, Dan Javitt, discovered something called the NMDA receptor in the brain and started to realize that it had profound implications for the treatment of psychiatric diseases that kill people every day. 2009 really made the first discoveries that drugs that affect this target in the brain have the potential to have profound effect not only on depression, but on the things that cause people to commit suicide. And 2009 is now 15 years ago. Well, it's taken 15 years to get to where we are this week, where we've now got our second clinical trial showing a statistically significant effect of our drug NRx 101, which is a combination of two well-known drugs, D-cycloserine and Lurasidone, showing the effect of NRx 101 both as an antidepressant that's every bit as good as the leading antidepressants, but as the first antidepressant that reduces the risk of suicide, reduces a side effect called akathisia. Most people have never heard those words because they're kind of medical speak, but akathisia is the side effect you can get from all known antidepressants where people feel like they're jumping out of their skins. They can't sit still. They feel the urgent need to do something. And if you combine that with depression and thoughts of suicide, all too often there's something they feel the need to do is jump off a roof or in front of a train. So for the first time really in pharmacologic history, we've demonstrated a drug that not only treats depression, but reduces those symptoms that can be lethal rather than increases them.
Dr. Javitt, did you have any inkling before that these were the results you were going to see, or did you have a gut reaction of feeling that, yeah, I think this is what's going to happen?
Well, we had a very good inkling, and at the risk of making people kind of chuckle, Dan saw this in the laboratory back in 2009. You can produce these symptoms in rodents. They don't talk to you, but they behave certain ways when you put them in a maze. Rodents that are particularly, agitated, anxious, will go and hide in the closed parts of the maze instead of going out and getting the cheese. So laboratory scientists who understand these areas of brain science are able to predict what's going to happen in people. So not only did Dan discover this back in 2009, but he patented it. It's taken 15 years to prove for the second time that the same thing happens in people.
Hey, Jonathan, talk about for us the press release that came out talking about efficacy earlier this week.
Well, that's really the discovery we're talking about. So we did a study of, there were a total of 91 people in the study, 76 of whom were in the efficacy part of the study, and some additional patients were just in the safety part of the study. And what we saw was that our new drug, our investigational drug, which has been given breakthrough therapy designation by the FDA, was an equivalent, a similar antidepressant. Both our drug and the standard of care drug were equally effective in treating the depression in patients with suicidal bipolar depression, but our drug had a marked effect in reducing akathisia. Next time I see you, I'll even bring you a picture, or I'll give it to your guys to put up for your viewers. But it's like, akathisia went kind of up this way when they got the standard drug, and it went down this way when they got our drug. It was a dramatic effect that was statistically significant to the 0.025 level, basically a 70% reduction in this side effect called akathisia. And this is the first time anybody's ever really dared do a clinical trial in patients with suicidal bipolar depression.
Why do you suppose that is, Jonathan?
Well, because it's risky to let people like this into a clinical trial.
Oh, no kidding.
If you're smart, if you're a big pharma company and you want to make billions of dollars, then test your antidepressant in people who are never going to harm themselves, but who are going to take your drug for the rest of their lives. You've got to be on a mission to say, no, let's go help the people who have nothing to look forward to but electroshock therapy. Let's see if we can find a drug that will change their lives in a positive way.
Hey, Dr. Javitt, good to see you again. We understand that you're participating in the E.F. Hutton conference next week, is it? Next week?
I think it's the 15th.
We are going to do that, yes.
Can you talk about that a little bit?
Well, E.F. Hutton is one of the investment banks that has represented us and whose investors have invested in our company. So their analysts have asked us to tell this whole story to their investor community, and we're happy to tell our story to anybody who wants to hear it.
Speaking of the story, Jonathan Javitt, by the way, of course, is founder, director, chief scientific officer of NRx Pharmaceuticals, NRxP. Lots of great news this week in terms of numbers and revenue and such like that. We typically don't talk about numbers and stock prices on the air, but what I do want to talk about is what you are looking forward to most for the rest of the year here, because you have a lot of things going, all of it in the right direction. You can tell just by the news standard of what's happening here that you are herding kittens into a wheelbarrow at one time here, but you seem to be managing to do that. Talk to us about what you're most looking forward to here, because obviously the word's getting out.
Well, sometimes if you put enough good stuff in the wheelbarrow, the cats want to get in by themselves.
Yeah, good point.
That's really what we're hoping for.
You know what? I've never heard that. We're going to write that down.
Sausage and milk.
This is why he's the doctor.
Right.
That's fantastic. So talk about the rest of the year for us in terms of what you can reveal.
And I talked about our other drug, ketamine, which we're filing for FDA drug approval because we've got solid data showing that ketamine both profoundly decreases depression, decreases suicidality. You might say, well, why don't we just stick with that? Well, the problem is ketamine requires an intravenous infusion. We're hoping to make it more easy for patients, but right now you have to come to a clinic. You have to get an intravenous infusion. Over time, like over 6 months, ketamine can damage brain cells. It's highly addictive. So we see it as a great drug for urgently helping people with suicidal depression, but not a great drug for the long term. And we're taking that drug into the FDA drug approval process this year. Meanwhile, the drug I just talked about, NRx 101, is a simple pill that people will be able to take in the comfort of their homes. And we've announced that that drug is partnered with a large pharmaceutical company, Alvogen, and their Asian partner, Lotus Pharmaceuticals. So they're now reviewing the data, and assuming they like the data as much as we do, they have a contract that enables them to take it into the registration process themselves and invest the funds that it takes to get a drug approved that could be used by millions of people.
Hey, Jonathan, I obviously great news and such. I never get to spend enough time with you on this, but I want to do this because Dr. Javitt and I have become friends. He's a bit of a mentor. We butt head on some subjects. We are line on other subjects. But I got to talk about this president's thing. You worked for 4 presidents. You worked in big pharma. You've worked in top universities. Why are you in the weeds, which is your favorite saying, into a small biotech company? Because you could be on the administration of some company.
But I just about flunked psychiatry in medical school. Dan was the brilliant psychiatrist, and I was happy to be his cheerleader. And then my best friend hanged himself in 2009.
Oh, my goodness.
Guy who was the head of the whole pain control program at NIH, guy who was top of his class at Harvard Medical School, top of his class at Yale College. And they put him on an antidepressant, and 3 days later, he hanged himself. And I said, this just doesn't work. So I said to Dan, well, what's going on? And he said, well, all the guys in big pharma, all the big pharmaceutical companies are exiting psychiatry. And that's really what happened. Every single one of the big pharma companies left psychiatry. So we decided that these patients need what we have, and we're going to bring it to these patients.
Love it. Dr. Jonathan Javitt is his name, founder, director, and chief scientific officer, NRx Pharmaceuticals, NRxP, and of course, NRxPharma.com. Have a great session over there at EF Hutton at the annual conference, and we will see you next week.